Dr. Shannon Charlebois is the medical editor of the Canadian Medical Association Journal, and it was she who co-authored that new editorial, Protecting Canada's Youth from the Risks of Exposure to Gambling Advertising. Dr. Charlebois, welcome to our program.
Thank you.
I would use the word ubiquitous to describe sports betting ads. You cannot escape them. How would you describe the current landscape?
In Canada, children are inundated with these advertisements. The University of Bristol did a recent study, and during the Stanley Cup final game between the Panthers and the Oilers, on average, a gambling advertisement, a logo, a sponsored segment, or a commercial was seen on average every 13 seconds. And by definition, if we are advertising during the daylight hours, during the hours up until 9 o'clock p.m., gambling advertisements during those times are directly targeting minors so that these corporations have a willing audience, not just now when they are minors, but as they grow into adulthood.
And we'll talk about the long term in just a second, but you in this editorial have identified gambling ads as being particularly insidious for children. Why is that? Why are young Canadians particularly vulnerable?
So when I'm watching a hockey game with my 8-year-old, he asks as many questions about the gambling odds as he does about the rules of icing. They're very dangerous for children, and particularly adolescents, who are biologically engineered to take risks, to value being social prestige, to value having money. And on top of that, we see these celebrity endorsements, particularly sports athletes. Now, the Ontario Alcohol and Gaming Commission in 2024 did say, okay, no more sports athletes can do these ads promoting gaming. But within days, we had Connor McDavid doing a safe betting ad, doing a harm reduction ad. Well, there's been a systematic meta-analysis of 166 studies. There is no proof that a safe sports betting advertising is effective. And in fact, there's quite a good deal of evidence saying that sports betting harm reduction, any strategies only increase the number and make it harder to quit gambling.
That's interesting because you just heard in Allison's reporting, the industry saying what's really needed is, increased awareness in education, that what you just pointed out as safe betting information would be considered a safeguard, which they feel is sufficiently in place already.
It's advertising by another name. What we need is prevention, and within Canada, it's ridiculous that we're allowing these ads. We don't advertise cigarettes to minors. We don't advertise cocaine to minors. And gambling addiction, make no mistake, can be just as harmful and destroy lives as any substance.
So is that partly because of what we know about an adolescent brain? Is there something there at that stage of development that makes young people, adolescents, especially susceptible?
Absolutely. From an evolutionary standpoint, we know that. But without getting into the neuroscience and the amygdala and the hippocampus, we know that young people are impressionable and they're going to listen to anything to do with pure prestige or celebrities over their parents, for example. There are steps parents can take to minimize the harms here, but we're seeing the quickest growth in the 16 to 24 set for problem gaming or gambling addiction.
So, and you write about this in the editorial, Canada's youth are being harmed. Where are you seeing an increase in those harms now, but also for the future?
Gambling is associated with an increased substance abuse, increased theft as minors become more desperate for money. They're reaching out for funds that involves theft from parents, from friends, borrowing money, increasingly from first friends, and then other places they should not be borrowing money from, which gets them in more trouble. Gambling in youth is associated with weapons charges, with assault charges, and a significant portion of incarcerated youth in Canada report a history of problem gambling.
And yet, in the face of that kind of research, we're still seeing this expand. And as Allison was pointing out, other provinces look to what Ontario has done. The concluding paragraph of your editorial begins with the line that we've highlighted. We thought it was quite powerful. Allowing glaring and ubiquitous promotion of sports betting is a willful mortgage of Canada's future to the interests of private profit and tax revenue. What should Canadian jurisdictions do, Dr. Charlebois, at this point?
All sports betting where minors can see them up until the hour of at least 9 o'clock p.m. should be eliminated. As a country, this should be abhorrent to us, and we should not stand for it. The jurisdictions have and speaking on a provincial level, have an inherent conflict of interest. During the first 3 years of iGambling in Ontario, since it was legalized in 2022, the Ontario government made $1.4 billion in tax revenue. What we need is on a federal level to regulate this. Bill S-211 is before the House now, and that bill needs to be expedited because that can allow for a federal framework to set standards within our country.
What kind of reception are you getting provincially, federally, to that kind of thinking, to those kind of proposals?
We do have several members of Parliament and senators in the House advocating for this. Certainly, I understand there are priorities within Parliament. I'm not a politician, but we do have Bill S-211 before the House, and that needs to be passed immediately.
Dr. Shannon Charlebois, thank you for the time today and interesting reading and reporting as we have on the editorial you have just penned in the Canadian Medical Association Journal. Again, thank you very much.
Thank you.